This is lesson 25. We're going to be talking about the Florida Board of Pharmacy and some very important definitions from the Florida Pharmacy Act. We're going to be covering book pages 128 to 133. So the Florida Pharmacy Act starts out with definitions, and it also starts out with a description of the Florida Board of Pharmacy. As I mentioned previously, the Board of Pharmacy is one of many boards under the Florida Department of Health. The Florida Department of Health has lots of the healthcare boards, including the Board of Osteopathic Medicine, the Board of Allopathic Medicine, Board of Pharmacy, Nursing, and a bunch of other ones as well. One thing to keep in mind is that the purpose of the Board of Pharmacy is to protect the public health, safety, and welfare. And as I mentioned in the study tips, when you're thinking about questions, always keep that in mind, as those types of questions and answers should always be related to protecting the public health, safety, and welfare. You should know the organization of the Board of Pharmacy. I always used to tell my students the people who write these questions come from the Board of Pharmacy, and they may want to ask questions about themselves. And every state's got a slightly different organization of the Board of Pharmacy. But these would be the easy types of questions, if they still have these types of questions, that you don't want to miss. In Florida, the Board of Pharmacy consists of 9 members. 7 of those 9 members are pharmacists. And these 7 pharmacists there are some requirements to be appointed to the Board of Pharmacy. You have to be engaged in a practice of pharmacy in Florida for at least 4 years. By the way, the other 2 members of the Board of Pharmacy are called consumer members because they're there to represent the public. Some additional requirements for the pharmacy members you'll see on page 128. Florida requires that at least 2 of the pharmacists on the board practice in a community setting, and at least 2 of the pharmacists practice in an institutional setting. And that could be modified, that could be a class 2, modified class 2, or class 3. The remaining other pharmacists can be in any type of practice setting. The consumer members have to be residents of Florida. They can't be licensed as a pharmacist, have ever been licensed as a pharmacist. They really can't be connected with the practice of pharmacy in any manner. And they also cannot be connected with a drug manufacturer or a drug wholesaler. Florida's got this unique requirement that at least 1 member of the board, either a pharmacist member or consumer member, must be 60 years of age or older. I guess that's because there's a lot of old people in Florida. I'm not sure, to be honest with you. Appointments to the Board of Pharmacy are made by the governor and then are confirmed by the Senate. Now, the board members actually have 4-year terms, and technically they can only serve 2 full terms. But there's this interesting provision in the law that says when a Board of Pharmacy member's term is over, until the governor makes a new appointment or reappoints that person, they can continue to serve on the Board of Pharmacy. And I'm not sure what's going on with the governor's appointment office in Florida, but currently I think 5 of the 7 pharmacist members' terms have expired, and they continue to serve on the Board of Pharmacy. And the one consumer position is currently vacant. That might get filled sometime during the year when you're taking this course. But even the consumer member's term has expired, and some of these have been expired since 2017, 2019, 2020. But until a new appointment is made, those people get to continue to serve on the board. I guess the governor is just too busy in Florida to make the appointments to the Board of Pharmacy. Okay, as I mentioned, most laws and most statutes, including the Florida Pharmacy Act, start out with a definition section. And I always tell my students that definitions are really the key to understanding legal topics and answering legal questions. Because what I do as a lawyer is I argue about what words mean, right? So the definitions become very, very important. And I think in Florida, it's particularly important because Florida tends to modify their definitions every time they're trying to move the profession forward and get some type of new innovative practice. They do it by modifying definitions in the Pharmacy Act rather than creating new sections of the law. And because of that, I just found it very odd that you will find mandatory obligations, things you must do, in the definition sections of the Florida Pharmacy Act. And I'm going to point some of those out. So it's just kind of odd that, you don't usually find obligations of things a pharmacist must do in the definition section. The definitions usually are just that, they're definitions. And there are also some very unique terms that Florida uses, and particularly if you're a pharmacist coming from out of state, that you may not be familiar with these terms. So make sure you understand when a question comes up and it's using some term you never heard of, we'll give you those definitions. So the first one is you'll see on page 129, consultant pharmacist. That's a special license that Florida has. In addition to being a pharmacist, you may want to become a consultant pharmacist, because that's where all institutional pharmacies in Florida are required to have a consultant pharmacist. And we'll go through all those licenses in another lesson, but the definition of a consultant pharmacist can be found here as well. The definition of dispense is a good example of what I was talking about. The definition of dispense is, what you would think of dispense to be: transferring possession of a doses of a medicinal drug by a pharmacist to a consumer. But then the definition goes on, starting on the bottom of page 129, that says, as an element of dispensing, the pharmacist shall, so here's something you have to do, prior to actually transferring the drug, you shall interpret and assess the prescription drug order for potential adverse reactions, interactions, dose regimen that he or she deems appropriate in the exercise of his or her professional judgment. What is that? That's drug regimen review. So you have to perform drug regimen review as part of the dispensing process. And then the definition goes on to say, the pharmacist shall also provide counseling on proper drug usage, either orally or in writing, if in the exercise of his or professional judgment, such counseling is necessary. So is that mandatory counseling? Not really. It's only if you think it's necessary. But then later on, we've got specific rules that talk about patient counseling, and they go into a lot more detail. So that's where trying to read the rules and the statute, sometimes you got to go to different sections. But within the definition of dispensing, what's included in the act of dispensing in Florida is drug regimen review and patient counseling, apparently. And I kind of explained that in the note on page 130. And it does say two things are not included in dispensing, and that's the actual sales transaction and handing the drug to the patient, and administration of a drug is not considered dispensing. So speaking of dispensing, you saw in there, it talked about a medicinal drug. That's another Florida term. A medicinal drug is really a prescription drug, or sometimes called a legend drug, but the Florida uses the term medicinal drug. And they also use the term patent or proprietary preparations to mean over-the-counter drugs. So if you see those terms, that's what they are. And unfortunately, the Florida laws and rules are not consistent. Sometimes they'll call them prescription drugs. Sometimes they will correctly call them medicinal drugs. But if you see medicinal drugs, you're really talking about a prescription drug. And similarly, the definition of pharmacy is very long because it includes all different types of pharmacies. So you'll see there's community pharmacies, institutional pharmacies, nuclear pharmacies, special pharmacies, and the board has different types of special pharmacies, and we're going to go over each and every one of these. And then there's an internet pharmacy, and we'll cover that as well, although I'm not sure anyone actually has that particular license. And we're going to go through all these different types of pharmacy permits, but this is part of the definition section. At the end of the definition of pharmacy, is another kind of mandatory rule or kind of an explanation. And you'll see it there. I have it under internet pharmacy. It really should apply to all the definitions of pharmacy. And it just talks about what happens when a pharmacy department is closed and what it means to be closed. Why this isn't a definition section, I have no idea. But what it says is that when a pharmacy permit does not have a pharmacist there, when a pharmacist is not present and on duty, and then they further define that, then the pharmacy department has to be considered closed. I will just read through that because Florida seems to be very big on that the prescription department must be closed when a pharmacist is not on duty. So if those definitions weren't long enough for you, wait till you see the definition of the practice of the profession of pharmacy, which starts on the bottom of page 131, and you can see it includes compounding, dispensing, consulting, about drugs, and then it goes over to 132. This is the actual definition. Look how long it is on page 132. And why is it so long? It's long because, as I mentioned, every time pharmacists want to expand what's considered the practice of pharmacy and expand pharmacy practice into things like collaborative practice and pharmacists test and treat, pharmacists administering vaccinations, that's got to be included in the definition of the practice of pharmacy. So that's why this definition keeps getting longer and longer and longer as pharmacists expand the scope of their practice authorities. You will see in there, not only does it say all the things you can do that are included in the practice of pharmacy, but it also specifically has some language about things you cannot do, and because that's, whenever we get these expanded opportunities, the doctors always want to try to put restrictions on it, and it says specifically that the practice of pharmacy does not permit altering a prescriber's directions. It also doesn't permit diagnosing or treating a disease. Now, you could do some of those things under collaborative practice, but you cannot independently change a physician's orders or directions or diagnose any treatment or disease. The good news is we're going to go through all of the requirements to do all these things that are listed in the practice of the profession of pharmacy, such as administering vaccines, collaborative practice, medication therapy management, and so forth. So a lot of things you see in this definition, we're going to go through the details a little bit later. And then there's a definition of prescription on page 133, which is fairly long. And we've talked about that before because that's the only place where I could actually find whether or not you could fill one from another state. And it talks about you can if it's to treat a chronic or recurrent condition. All right, so that's the introduction to this chapter. And next, we're going to talk about licensure and licensure of individuals rather than licensure of buildings or permits for pharmacies. We're going to talk about licensures of individuals in lesson 26. So we're going to start up again on page 133.